Taiwan's daily case count surpassed 20,000 for the first time on Tuesday. The CECC reported 23,102 local COVID cases, along with 5 COVID-related deaths among unvaccinated older adults. Also on Tuesday, the CECC announced shorter quarantines for international arrivals. Starting May 9th, overseas arrivals will need to quarantine for just 7 days, down from 10. The quarantine period must be followed by 7 days of self-health management.
我们现在对于入境的旅客本来是10+7，那我们宣布从5月9号0时起。
Our quarantine requirement for overseas arrivals is currently 10+7. We're announcing that starting at midnight on May 9th, the quarantine requirement will be reduced to 7+7. That's 7 days of home quarantine and 7 days of self-health management. At the airport, arrivals will need to take a PCR test, either with a saliva sample or a nasal swab. Then, on the 7th day of their home quarantine before the release, they will need to take a rapid test. If they develop symptoms during quarantine, they can take a rapid test. If the result is positive, it must be reported. Generally speaking, home quarantine should adhere to the principle of one person, one home. If this condition cannot be met, then a quarantine hotel must be booked for 7 days.
In related news, the U.S. Centers for Disease Control and Prevention has raised its COVID travel risk level for Taiwan in light of its escalating epidemic. Taiwan was moved up from low risk to moderate risk on CDC's scale. This means that Americans with a weakened immune system are advised to talk with a clinician before traveling to Taiwan, even if they're up to date with their COVID vaccines. The CDC kept China at the level of low risk despite the country's latest outbreaks and ongoing lockdowns.